Hi, good evening, Dr. Helen. Um,
Good, Rajni.
okay, so as I was talking to you before, the response what we receive from various people in and outside of the India regarding the interview for nursing journey, whatever we started doing it, it's really overwhelming and it's really encouraging. So, continuation of our last episode, I would like to explore more about your nursing career or nursing journey. So, going backwards, you mentioned that you have completed your BSc nursing from Coimbatore and you really showed interest. You started building up, even though it was an accidental entry into nursing, you started building up due to various teachers and various opportunities you had in your college. And is it possible for you to explain about your beginning of career, how you began your career?
Yes, beginning
Yeah.
of career, I have started with my clinical instructor, and then I worked in my own college. I got an opportunity because Geeta madam gave the donation. Instead of that, I put a bond. I worked there. After 2 years, I went to Bangalore. Bangalore, I worked in Florence Institute of Nursing. Afterwards, I joined in Sarvodaya. Meanwhile, get married. I got married. Then I got opportunity from abroad. There was an interview from the military hospital, King Khalid Military Hospital, Saudi Arabia. That time, no prometric exam, but there was one exam was there, not named as a prometric. Delegates will be coming and conducting. Most of the questions asked from the CPR and about the drugs, crash card drugs and the drug calculation. So why I am telling is, these are all the very important questions will be asked by the foreigners. So every time we have to update the knowledge about the crash card, new rules. CPR means ABC will change the CAB like that. ACLS, BC, so many changes. Whether we are updating, they will be checking delegates. Then they have conducted interview. Then I went to abroad. The rules and regulations, policy, protocol is completely different from Indian scenario to the military. That and the religion also law is different. Though Indian government is supporting us, very crucial. Very I was so much afraid to go to in the young age 23, 24 year I am entering into the Saudi Arabia, which I do not know the language and everything.
Mm.
Okay, and also the military hospital. The very important policy change in that is, even you want to give one paracetamol tablet to the patient, you have to sign by the two nurses.
Okay.
That is the policy. So first thing, they will give a orientation training. Though we are writing exams and selected coming here, again medical tests they will conduct. Again they will conduct exam. Again CPR. This kernel we have to pass. Then only the job will be given. 3 month,
Mhm.
4 month probationary period
Mhm.
compulsory they are following. So
Mhm.
then when study time itself, we have to concentrate on the like a practical. Why I am telling is now currently ASCII is introduced. The
Mhm.
coming students, all the teachers, I would like to say more ASCII stations on pharmacology, crash code drugs. So many training we give, then easily our students can fly abroad. That is the thing I
Yeah.
want to tell. And it was difficult, and somehow we have crossed that level. And
Okay.
then I was working I was a little bit afraid about the night duties. So
Okay.
I was I worked in a primary healthcare center. It's like
Mhm.
a mini hospital. We have a mini
Mhm.
operation theater, mini dressing room, mini
Mhm.
OT. Everything will be there in that. Every street it will be there. It was a wonderful experience I
Mhm.
have got. Language within language is no. I mean, language is an important part of communication. But with the accent and other thing, I learned their language within 3 months.
Okay.
So I have been
So,
posted.
yeah, and I know
Yeah.
your journey is long and you started explaining your abroad experience and everything. But before that, I just want to go back, pull you back to your, did you mention about clinical instructor job you had in your college, right? The same college where you studied.
Yeah, 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 yeah.
Would you focus, let us focus on that today and your experience as a clinical instructor, because after traveling this month, this long in our
Yes,
career.
after traveling this one, after immediately joining clinical instructor, even
Mhm.
though we got posting in ESA hospital, KG hospital, we have a hands-on experience. We have maternity center. We have conducted very boldly, and we have stayed in what is that one doctor running clinic, no, where we were going one hilly area. One doctor was running in a tribal area. We took a practice with hands-on practice also. But when clinical instructor, teaching was good, but I was not much bold enough with a clinically very confidently stand in
Confident
front
enough,
and do
yeah.
my
Okay.
lab, confident enough to lab practices. I usually take a very good classes, very good, but lab, which was a little bit inconfident, some guilty feeling. I was not work as an nurse. But after I come back from Saudi Arabia, I am very confident enough in clinical teaching, even ICU or emergency, how to manage, hands-on training, disaster drill, how to conduct, how to organize conference, like all the knowledge, multinational people working together with various ideas explored. What is the difference between the Indian scenario and the foreign scenario? Foreign in the sense, not only Saudi Arabia. Saudi Arabia, Irish people are there, Americans are there, Egyptians are there, women. It is a multi mix of cultural. So
Yeah.
once you go out, totally everything is a good experience, really
No, I totally
wonderful
agree
experience.
with you because in one of my interviews, the first question was asked, being in India, I mean, coming over to European country from India, and what is the difference? And I said, see, there everything is building a castle on the air.
Mm.
But whereas here everything is so practical, they do training. I mean, like for the nurses, they do yearly mandatory training, and everything is so practical. So definitely the practical experience is needed. What is your advice for the people who complete the BSc nursing at the moment? I mean, because through your experience, especially that clinical instruction, I mean, like,
Yes, yes. But in
eh,
Tamil Nadu nurses, my advice might have different because we have
okay,
a multiple hospitals. Really, they go and take the clinical experience. Or if I was working in Apollo for more than one decade, all are observed in the clinical field. Somehow they are suffering lot, stress, everything, but come out as a very good nurses. Within 2 years, they fly abroad again. But
exactly.
in the West Bengal scenario, very difficult to get the job. And the mentality of the West Bengal people, they don't want to move from the West Bengal. Now
Mm,
every year, GNM and BSc together, 3 lakhs nurses are coming out. So much
mm,
competition is there. First
yeah,
thing, my advice is they have to go out and out, maybe Delhi nearby or any good hospital. They have to go and work at least 1 or 2 years, never mind about salary less or something, gain knowledge, then try to go abroad and come back.
yeah.
Come
The
back.
cultural factor, the way they
Yes.
grow up, and the family members may
Compare
demand
with the
them.
engineering field, compare with even doctors, nurses have a beautiful opportunity to go. India is the platform to supply the nurses throughout the world.
Mm,
Philippines and the Indian nurses. Indian nurses are high demand in the market.
okay.
That you have to
Yeah,
utilize it.
yeah, yeah. I mean, I totally agree with you.
Mhm.
India has a good workforce supply. I mean, especially nursing, and there are a lot of nurses coming to European countries also. But at the
And
same
one more small
time,
advice, Rajni, one more
mhm,
small advice. Student nurses are thinking that fourth year is finished, everything is finished. Actually, their study must be started from the zero level to again. NORCET
exactly.
exam, many exam, competitive exam, CBT, many they are conducting. They have to start study. All the they have a protocol that anatomy 20 mark, physiology 20 mark. So everything they have to study. Either the most opportunity they have to study. So they should not think that it's not a field like I finished, I don't need to touch the book.
Yeah,
Continuous race course it is.
yeah,
You
yeah.
have to
I agree with
ride.
you. Being in mental health nursing, when I look back, we studied anatomy, physiology, and a lot of complex science and medical science items,
Mm.
pharmacology, everything. But are we utilizing all this knowledge and everything? It's a big question mark. But the thing is, India, and definitely Indian institutions are giving us a good theoretical foundation. But we need to
Mm.
seek for a practical experience. As you mentioned, instead of working as a clinical instructor immediately, if you had worked as a worked in a clinical area, a real clinical area, you would have gained more experience, confidence. You could have built up your
Confidence,
confidence at the
self-confidence,
beginning.
self-esteem.
Yeah. So,
Mm.
yeah, to develop our self-confidence, definitely we need a clinical experience. Okay. So today you have mentioned about your clinical instruction, and you started mentioning about your abroad experience. Which country? Would you mind telling me again which country?
Saudi Arabia.
Saudi
Saudi
Arabia,
Arabia.
which is okay. Okay.
King Khalid
So
Military Hospital.
military hospital. Okay. We'll come again in the next episode, and we'll start saying a few other things. Thank you so much for today.
Thank you, Rajni. Thank you
Thank
so
you.
much.